Robert Johnston, European Patient Board Member. Today you were at the European Annual Conference for Personalised Medicine. You're one of the patient speakers in the opening plenary session. Do you have any key messages for policymakers?
I think what patients want is, first of all, the right diagnosis, first time. Then they want the right medicines at the right time, when they need them, without having to bankrupt themselves in order to get those medicines. And they want to live independent lives as much as possible. If the medicine can help them get back into mainstream society, go back to work, live their lives as they used to live them, that's what they'd like.
The European Alliance for Personalised Medicine is a multi-stakeholder organisation and bringing together 5 groups of stakeholders: patients, medical professionals, healthcare planners, industry, scientists and researchers. Do you think there should be more collaboration between different stakeholders to develop better treatment for the patients, and how can we do this?
I absolutely believe that there should be as much collaboration as possible, and not just within the medical world, but into the social arena and in every possible way, because what we're about is trying to keep people in mainstream society, not exclude them, not have to live away from the workforce, away from their family, not coming out into mainstream society.
So one of the key asks that we've put forward at both a European and a national level is to ensure patients are involved in the decision about their own healthcare. How can this be improved, and what should policymakers do to facilitate this?
Okay, one thing that's very important for patients is the whole idea of self-management of their conditions. So the most important thing, I think, is to recognise that patients have the right to do that. That they have the capacity, they have the understanding, they have some experience of their own lives, which the health professionals wouldn't have. They may know the range of the condition, they may know the likely prognosis and development, but they don't know everything about the individual patient. And the individual patient should have the opportunity and the right to interact with their healthcare professionals, to come up with the right regime that works for them, recognizing that they're still independent citizens in society and that they can add information and knowledge which the healthcare professional probably doesn't have about their individual situation.
Ian Banks, President of the European Men's Health Forum. One of EAPM's activity is SMART, which stands for Smaller Members and Regions Together, and was setting up national alliances to facilitate better access to treatment for patients. Taking account how the UK has organised their healthcare system, is any best practices that Europe could take from the UK and vice versa?
I think one of the big issues is access to medicines. But before we even get to the access of medicine, of course, we have to have the appreciation of the use of the service in the first place. What is happening in the UK is an awareness of the importance of health navigation. So what we can take from examples like the UK, but also in Denmark, for instance, is another good example, is how do you actually improve people's use of the services which are there at the moment? And from that we get better contact, from that we get better earlier diagnosis, and all of these things work better when we have personalised medicine.
Etienne Richer, Europe has put personalised medicine on the map. We just had the Council conclusions on personalised medicine. Last year, Obama launched the Precision Medicine Initiative. What is Canada doing in this area?
We've been doing since 2012 the Canadian Institute of Health Research Personalised Medicine Signature Initiative, through which we'd had multiple funding opportunities. The flagship program was the large-scale applied projects launched in 2012 in collaboration with Genome Canada. And at this point, the projects really going into the clinic, about 10 million Canadian dollars each, are really starting to bear some very interesting results. So we're looking forward to share those results with Europe's and other partners to see what can be done to accelerate the implementation of personalized medicine. And as we speak, actually, we are looking at the next phase of the development of this signature initiative, which will include a lot of data management, really integrating genomics into the clinic, and trying to see how to develop a pan-Canadian really platform to share data, including the omics data, but also all the healthcare administrative database and other data source, social media, and so on and so forth. So this is really where we are at right now.
Okay. Stephen Shack, founder of Genomic Health, co-founder of Genomic Health. Europe has made a lot of progress in developing an environment for personalised medicine. We just had a council conclusion of personalised medicine. Last year, Obama launched the Precision Medicine Initiative. So we're both going in the same directions. How can we learn from each other to make the progress even faster?
Yeah, we share the same goal. We are inspired by patients not to think about their disease in terms of one size fits all. What we need to do more of is not only have these fantastic discoveries and new innovations that can change the outcomes for all of us. We need the systematic changes to implement them, to make sure that they're paid for, reimbursed, and available. The whole world is struggling to figure out how to do that, and bringing us together at meetings like this is a critical way that we'll share and help each other get to those solutions as quickly as possible.